point that we have is liver 1. Liver 1 is going to be in the lateral corner of the big toe, a 10th soon from the base of the nail. So that's the first point we're going to go over, the Jingwell point. And then after that, we have liver 2. So liver 2 is going to be 0.5 soon proximal to the margin of the web. So we're moving from the margin of the web just slightly inward. And what you do, you need to put counter pressure on the bottom with the middle finger or index finger, and then you just squeeze, and then pull towards yourself slightly. And that's where liver 3 is. You have to have a finger on the back side because you're just not going to get the pressure you need if you just put downward pressure. So we grasp and squeeze this point. And the next point we have is liver 3. Liver 3 is just going to be distal to the junction of the first and second metatarsals. And the way I like to work into this point is I like to start just a little bit low and then just roll up into it like so. And I use the fingers on the bottom of the foot as a counterpoint pressure. This is an easy point to do like one thumb meditation into if you work into it, or just do pressing and kneading. And this one's, be tender on most people. Then the next point we have, is it okay if I pull this up slightly?
Yep.
Okay, just for liver 5. Okay, so liver 5. 5 soon above the medial malleolus, just posterior to the border of the tibia. So there's 1, 2, 3, 4, 5 soon. And there will be a depression here very similar to spleen 6 at this point. So this is liver 5. And then next we'll move up to liver 8. So the way to find liver 8 is we had 2 points like in the same line. So we had kidney 10. Kidney 10 is in between semimembranosus and tendinosus, and I know you can't see the musculature right here, but I'm just grasping very close to the medial epicondyle of the femur, and I'm just grasping the front and back. And for kidney 10, all you have to do is take your index finger and push it towards the center and between those tendons. That's the easiest way to find it. I've never seen a good picture of this point in any book that I've seen so far. But that's kidney 10. Liver 8 in relation is going to be in front of those tendons. So you can grasp semimembranosus tendinosus here, and now you'd be in front of the tendons. And I'm going to come to the side of the table. In this point, you want to hook and angle in slightly. Okay, and this is again angling close to the head of the femur when you work into the point. Okay, the kidney 10 and liver 8 are pretty tender on most people as well. And we're moving upward to liver 13, the end of the 11th free-floating rib. And remember, like I said, the 11th rib will come slightly anterior to the axillary midline. And if you feel, the end of the 11th rib will feel hard. So if you feel hardness at the end of the rib, you're definitely on the point. And here Stephanie's 11th rib is very easy to feel and to palpate into. And what you do is you just hook towards the tip of the rib. So that's liver 13. The difference between the 11th rib and the 10th is the 10th rib will feel kind of squishy, and it won't feel as hard at the tip because it has a costal cartilage that's connecting the bonier structure and connecting the ribs together. So, and then the last point we have is going to be liver 14. Liver 14, I think the easiest way to find, it's in the 6th intercostal space. What you do is you just go to the sternal angle and then you slide laterally, and that pretty much is going to take you right to the point. So in relation, we had gallbladder 24, just one rib below in the 7th intercostal space. And liver 14 is the moo point for the liver. Liver 13 is the moo point for the spleen. So this particular meridian has 2 moo points on it. Okay, so those are the points we'll find there. I think pretty easy.